how to know if you're a medical entrepreneur is if you're somebody who enjoys being successful, someone who enjoys being in control, someone who enjoys being in charge, someone who enjoys learning new things, and someone who is probably, throughout your life has mastered skills, has mastered different levels of achievement very quickly, usually in the top, I'd say like 3%, maybe top 5%. These are typically the highest performers. And so these people are driven to be successful. These people are driven to constantly push and improve. For most people, most people look at them and say, oh, you're already successful. Why would you keep going? And for them, the reason why is because the success itself is what they're after. It's the growth. It's the process. It's not the destination. It's the journey, right? And so that's the most driving factor for most medical entrepreneurs. One of the other things that medical entrepreneurs first learn is they start to understand what business they're in. And so for a lot of people in medicine, they don't realize this because medicine is such a complex field, and the skill sets in medicine can be complex to learn and execute. So many times what you find is people that are so focused on their given trade. So maybe they're a dentist and they're so focused on, how do we, clean teeth? How do I fill a cavity that's, in this location? What's the latest technique for this or that? And while those things are important, medical entrepreneurs realize that, hey, they're running a business, they're running a clinic, they're running a practice. What business are they really in? And the conclusion that medical entrepreneurs come to is that they're in the business of acquiring new patients. That's their primary business, because you start to realize when you have your first practice that you could be the best doctor in the entire world, but if you don't have any patients to work on, that doesn't really matter, does it? And the thing is that if you can get patients in, you can also find other people to help you, and you can hire other medical professionals to do some of the work for you and even follow your protocols that you design, that you use in order to do that. And this is exactly what happened to me. When I first started my first practice, I started out as a 1099 contractor because I did not want to be controlled by a hospital corporation. I saw the way the bureaucracy was in hospitals. I didn't want any part of it. I didn't want someone who knows nothing about medicine telling me how to do my practice. I didn't want a nurse manager, telling me how I should practice or what I should have to do. I didn't want to have to go to someone and beg for time off. I didn't want to have to do any of that stuff. It just rubbed me the wrong way. Like I wanted to be in control of my life. I felt like I'd done enough training. I'd done enough work in my life that at this point I should be able to control my own life and my own destiny. And even if I didn't know how to do everything perfectly, and even if I made a mistake, I would rather have that than to have someone else calling the shots and be dependent on them.